The doctor's voice cut across the emergency room like a scalpel through skin. Another one. Homeless. Probably hasn't seen a shower in weeks. Claims he doesn't need pain medication for fractured ribs. Right? The old man on the gurney didn't flinch. His hands, scarred and weathered, rested calmly on his chest despite the obvious pain that tightened the lines around his eyes. What the doctor didn't know, what nobody in that sterile white room knew, was that in exactly 14 minutes those hands would save a life while the doctor's credentials crumbled to dust. Dr. Ethan Westbrook moved through the emergency department like he owned it. At 32, he had the kind of confidence that came from never being told no. His white coat was pristine. His stethoscope hung around his neck like a trophy. And right now, his contempt was focused entirely on the man lying on Gurney 7. The paramedics had brought him in 20 minutes ago. Collapse near the VA hospital. Severe dehydration. Multiple contusions. Fractured ribs on the left side. The kind of injuries that screamed for morphine or at least some fentanyl to take the edge off. But when the nurse had offered pain medication, the old man had refused. "With respect, ma'am, I'll pass." Westbrook snorted as he reviewed the chart. He'd seen this before. Drug seekers who thought reverse psychology would work. Play hard to get with the narcotics, and eventually someone would push them harder. It was transparent and pathetic. He approached the gurney with 3 medical students trailing behind him like ducklings. Teaching moments were Westbrook's favorite part of the job, especially when he could demonstrate how to handle difficult patients. The old man watched him approach. His eyes were gray and calm. Too calm for someone with 3 fractured ribs and an infection spreading across both hands. Westbrook noticed the way the man assessed him. A quick glance that took in everything. Height, weight, dominant hand, potential threat level. It was the kind of automatic evaluation that came from somewhere, but Westbrook dismissed it. "So," the doctor's voice carried across the bay, ensuring the students and nearby nurses could hear. "You're refusing pain medication. That's interesting." He emphasized the last word, making it clear he found it anything but interesting. Most people with your injuries would be begging for relief. The old man's voice was quiet. Hoarse from disuse or dehydration or both. "I don't need it, doctor. Don't need it." Westbrook smiled. The condescending smile he reserved for patients who thought they knew better than medical professionals. "You have 3 fractured ribs. Your hands are infected. You're severely dehydrated. But you don't need pain medication." "No, sir." The sir threw Westbrook off for half a second. It was automatic. Military. But this man looked like he'd been living on the streets for years. The flannel shirt was more whole than fabric. The boots were held together with duct tape. The smell of unwashed clothes and old sweat hung around him like a cloud. Westbrook turned to the medical students. "This is what we call drug-seeking behavior with a twist. Instead of asking for narcotics directly, the patient refuses them, hoping we'll become concerned and push harder. It's manipulation. Transparent, but we see it regularly with this population." One of the students, a young woman with kind eyes, frowned. "But Dr. Westbrook, if he's refusing medication, how is that drug-seeking?" Westbrook's smile thinned. "Because eventually he'll accept, and then he'll ask for more and more. It's a game, Dr. Chun. You'll learn to recognize it." The old man on the gurney spoke again. His voice was still quiet, but there was something underneath it now. Something that made Westbrook pause despite himself. "With respect, doctor, I'm not playing games. I need to stay sharp." Westbrook laughed. Actually laughed out loud. "Stay sharp? For what exactly? You collapsed on the sidewalk. You're homeless. What possibly requires you to stay sharp?" The old man's eyes shifted. For just a moment. Past Westbrook. Past the medical students. To the bay across the narrow corridor. To Gurney 9, where a young man in his mid-20s lay, with an 4 running into his arm. The patient had been brought in an hour ago with abdominal pain. Possible appendicitis, according to the attending notes. The old man looked back at Westbrook. "That boy over there needs watching." Westbrook followed the gaze, then turned back with barely contained irritation. "That patient has been evaluated. He's stable. And you," he pointed at the old man's chest, "are not a doctor. You're a homeless man with delusions of medical expertise." The old man didn't react to the insult. His hands remained still, his breathing steady despite the pain that had to be radiating through his chest with every breath. "I've had training, sir." "Training." Westbrook seized on the word like a weapon. "Where exactly? What medical school? What residency program?" "Navy, sir." "Long time ago." Westbrook's contempt crystallized into something sharper. "So you were a corpsman?" "Maybe. Decades ago. That doesn't make you qualified to diagnose patients in my emergency room." He turned to the students. "Note how the patient attempts to establish credibility through vague claims of military service. It's common with this demographic." Dr. Chin spoke up again, her voice hesitant. "Should we at least verify his service record?" Westbrook waved a hand dismissively. "We're not the VA. We're an emergency room. Our job is to treat his immediate injuries, not chase down stories about his past." He looked back at the old man. "You're going to accept pain medication. You're going to stop playing games. And you're going to let us do our jobs." The old man's voice didn't rise. Didn't change tone at all. "I respectfully decline, doctor. I need to stay alert. Then we'll have a problem." Westbrook's voice hardened. "Because I can't treat a patient who refuses treatment. And if you're refusing treatment due to altered mental status or delusions, I can order a psychiatric evaluation and hold." The threat hung in the air. The old man's expression didn't change, but something flickered in his gray eyes. Not fear. Something else. Something that looked almost like pity. "Do what you need to do, doctor." But that young man across the way, his voice dropped even lower. "He's going to crash within 2 hours if you don't watch his abdominal rigidity and referred shoulder pain. The signs are there if you look." Westbrook felt his face flush. The audacity of this homeless man, this street person who probably couldn't even remember his last real meal, presuming to tell him how to practice medicine. He opened his mouth to respond, but the old man wasn't finished. "Before we continue, wherever you're watching from, we'd love to know your city or country. Stories like this one happen in every community, maybe even yours. You might have a quiet legend in your own neighborhood whose humble appearance hides an extraordinary story of service." The old man's hands moved slightly, adjusting position on his chest, and for just a second his sleeve rode up. Dr. Chin gasped. There, barely visible beneath the grime and age, was the edge of a tattoo. Not the crude prison ink or street tattoos Westbrook had seen countless times. This was precise, professional, military. What you could see looked like coordinates, numbers, and what might have been the beginning of a date. The old man pulled his sleeve down, but Chin had seen enough. "Dr. Westbrook," she started, but he cut her off. "Enough." His voice was sharp now, loud enough that nurses at other stations looked up. "This man is exhibiting signs of altered mental status, delusions of medical expertise, refusal of appropriate treatment. I'm ordering a psychiatric evaluation." He looked at the charge nurse. "Get psyched down here, and keep him confined to this bay until they arrive." The old man closed his eyes, not in defeat, in something that looked like acceptance, or maybe resignation. His chest rose and fell with careful, measured breaths that had to hurt like hell with fractured ribs. Westbrook turned away, the medical students following. As they walked toward the next bay, Dr. Chun looked back. The old man's eyes were open again, watching, not the doctors walking away, but the young patient in Bay 9, watching with the kind of focused intensity that didn't match the homeless drunk Westbrook had diagnosed him as. In the young patient's bay, monitors beeped steadily. Heart rate normal. Blood pressure stable. Everything looked fine. Everything looked completely normal. But the old man kept watching, his scarred hands perfectly still on his chest, his breathing measured and controlled despite the pain. And in exactly 13 minutes, when the monitors in Bay 9 started screaming, everyone would understand why he needed to stay sharp, why pain medication would have dulled the edges he needed to see what was coming, why some men carried their training in their bones long after the uniform came off. But right now, Westbrook was writing orders for psychiatric evaluation. Right now, the contempt in his voice still echoed through the emergency room. Right now, nobody knew that the homeless man on Gurney 7 had once performed surgery in a firefight with no anesthesia, saving a life while bullets chewed through the walls around him. The old man's fingers touched his chest, right over his heart, where dog tags used to hang, where a trident had once marked him as something more than what he appeared to be. Still here, he whispered, too quiet for anyone to hear. Still watching, still trying. And across the narrow corridor, the young veteran's monitor beeped steadily on. For now, that morning, Vincent Harlow had woken at 0530. Not because an alarm had gone off. There were no alarms when you slept behind a dumpster 3 blocks from the county VA hospital. He woke because his body still remembered reveille after 40 years. Some habits the body never forgot. He had walked the 2 miles to Arlington Heights Military Cemetery. The same walk he made every morning. Rain or shine. Summer heat or winter freeze. His boots, held together with duct tape and prayers, knew the route by heart. Past the closed storefronts. Past the early morning joggers who crossed the street when they saw him coming. Past the coffee shop where the smell of fresh brew reminded him of better days. The cemetery gates opened at dawn. Vincent was always the first one through. Ryan Michael Harlow. The gravestone was simple. Black granite. Born March 15th, 1987. Died August 23, 2011. United States Marine Corps. Bidovedson. Vincent knelt in front of the stone. His knees protested. Everything protested these days. But he knelt anyway because Ryan deserved that respect. He pulled out the photograph he carried in his shirt pocket, worn soft at the edges from being handled every single day for 7 years. Ryan is dressed blues. 24 years old. Smiling. Alive. Still here, son. Vincent's voice was rough. Still trying. The IED had been buried in a road they had cleared twice. Twice. Vincent had trained Marines on how to spot them, had written protocols that saved hundreds of lives. But he hadn't been there that day. Hadn't been there to see the signs. Hadn't been there when his son needed him most. The blast had been catastrophic. That was the word the notification officer had used. Catastrophic. Like that made it better somehow. Like a bigger word made the loss more bearable. Sarah hadn't survived it. Not really. Oh, she had kept breathing for another 2 years. Had kept going through the motions. But Vincent had watched the light go out of her eyes the day the officers knocked on their door. Had watched her fade a little more each day until her heart just stopped. The doctors said it was a cardiac event. Vincent knew better. You could die from grief. He had seen it happen. After Sarah died, Vincent had looked at their house, at the photos on the walls, at Ryan's room, still exactly as he had left it, at the life they had built together. And he couldn't do it anymore. Couldn't wake up in that bed without her. Couldn't walk past Ryan's door. Couldn't keep pretending he deserved any of it. So he had left, written a note. I'm sorry. I love you both. And then he had walked away from everything. From the pension. From the house. From the few friends who tried to help. He had walked away because men like him, men who failed to save their own sons, didn't deserve comfort. Vincent touched the gravestone. The granite was cool under his scarred fingers. Stay safe. Document. I'll need you there. Ryan's last words before he deployed. The last conversation they ever had. And Vincent hadn't been there. Hadn't been there when it mattered most. He stayed at the grave for an hour, talking quietly, updating Ryan on the other veterans he had helped. There was Tommy, the kid from Desert Storm who finally got into housing last week. And Maria, the Army nurse who was 3 months sober now. Small victories. Small ways of making up for the one life he couldn't save. When Vincent finally stood, his ribs screamed. He had taken a fall 2 days ago, tripped over debris behind a shelter. Heard the crack. Knew immediately what it was. 3 ribs on the left side. He had fractured enough ribs in other people to recognize the signature pain. But he hadn't gone to the hospital then. He had things to do, veterans to check on, a routine to maintain. Pain was just pain. He had lived with worse. The walk back toward the VA hospital was slower. Each breath pulled at the fractures. But Vincent had learned a long time ago how to compartmentalize pain, how to put it in a box and keep moving. Navy SEAL training had taught him that. 23 years as a combat medic had reinforced it. He was half a block from the VA when the world tilted. Dehydration. He recognized the symptoms even as his vision grayed. Not enough water. Not enough food. Not enough sleep. The body could only take so much. Vincent felt himself falling. felt the pavement rising up to meet him, heard voices, distant, concerned, felt hands on him, checking pulse, checking breathing, professional hands, paramedic hands, then nothing. When he woke, he was in the back of an ambulance, oxygen mask over his face, for in his arm, a young paramedic leaning over him with worried eyes. "Sir, can you hear me? You collapsed. We're taking you to County General." Vincent tried to speak, but the mask muffled his words. The paramedic lifted it slightly. "Bah, Binsan Manaja. Take me to the VA." The paramedic shook his head gently. "Sir, County General is closer. You need immediate care. We'll get you stable there." Vincent wanted to argue, but the exhaustion was overwhelming. He closed his eyes, felt the ambulance moving, felt his body shutting down systems to preserve what little energy remained. He thought about Ryan, about Sarah, about the life he had walked away from because he didn't deserve it, about the veterans he tried to help because maybe, just maybe, if he saved enough of them, it would balance the scales, would make up for the one he couldn't save. When they wheeled him into the emergency room, Vincent forced his eyes open, took in the organized chaos. The nurses moving with practiced efficiency, the doctors barking orders, the monitors beeping their steady rhythms. And then he saw him, Benon, a young man, mid-20s, dark hair, lean build. Something about him screamed military even in civilian clothes. The way he held himself despite obvious pain. The tattoo barely visible on his forearm. Vincent's medical training kicked in automatically. Assessed the patient from 30 feet away. Noted the way he favored his right side. The slight yellowing around the eyes that suggested something happening in the abdomen. The way he touched his shoulder. Referred pain. Classic presentation. The young man reminded him of Ryan. Something about the jawline. The age. The way he tried to be brave while clearly terrified. Vincent's chest tightened. Not from the fractured ribs. From something deeper. That was when a nurse came over. Asked about pain medication. And Vincent knew he needed to refuse. Knew he needed to stay sharp. Because that young man across the corridor was going to need help. And Vincent had failed his own son. He wouldn't fail this one. The doctor came then. Young. Arrogant. Looking at Vincent like he was trash that needed disposal. Vincent had seen that look before. On people who judge by appearance rather than substance. Who saw the homeless man, but not the human being underneath. It didn't matter. The doctor's contempt didn't matter. The psychiatric evaluation didn't matter. The pain radiating through his chest with every breath didn't matter. What mattered was the young veteran in Bay 9. What mattered was staying alert enough to see the signs. To recognize when things went wrong. To be ready. Because Vincent Harlow had spent 23 years saving lives in the worst conditions imaginable. Had performed surgery in firefights. Had treated hundreds of wounded warriors. Had pioneered techniques that were now taught at every combat medicine course in the military. And he had failed once. Failed when it mattered most. Failed to be there for his own son. He wouldn't fail again. So when the nurse asked about pain medication, Vincent refused. When the doctor mocked him, Vincent stayed calm. When they threatened psychiatric holds and forced treatment, Vincent accepted it all with quiet dignity. Because across that narrow corridor, a young man who reminded him of Ryan was dying. The signs were there. Abdominal rigidity, referred shoulder pain, the slight drop in blood pressure that the monitors hadn't caught yet. The way he shifted position, trying to find comfort that wouldn't come. Vincent had seen it 100 times. In field hospitals, in combazon, in places where if you didn't recognize the signs fast enough, men died. Splenic rupture, probably from blunt force trauma. Could have been days ago. Small tear, slowly bleeding. Building pressure. The spleen was a tricky organ. Could rupture slowly. Could seem stable until it wasn't. Until everything cascaded. 2 hours. That young man had maybe 2 hours before he crashed. And Vincent would be there. Alert. Sharp. Ready. Still here, son, he thought, looking at the young veteran. Still trying. Still watching. The monitors beeped their steady lies. Everything looked fine. Everything looked completely stable. But Vincent knew better. He had always known better. And in 93 minutes, when those monitors started screaming, everyone would understand why a homeless man refused pain medication, why staying sharp mattered more than comfort, why some training never left you no matter how many years passed or how far you fell. Vincent closed his eyes, not to sleep, to conserve energy, to stay ready, because when the moment came, he would need every ounce of strength he had left. Still here, Ryan, still trying to save them, even if I couldn't save you. Dr. Westbrook returned 30 minutes later with an entourage. For medical students this time instead of 3. A teaching moment required an audience. He carried a tablet displaying Vincent's preliminary labs and imaging results. His expression carried that particular smugness reserved for doctors who believed they had caught a patient in a lie. Gather around, everyone. Westbrook's voice projected across the emergency department. We have an excellent teaching case here. Male, approximately 65 to 70 years old. Homeless. Presence with multiple trauma, including fractured ribs, dehydration, infected wounds on extremities. He tapped the tablet screen. But here's the interesting part. Patient refuses all pain medication and claims medical expertise based on alleged military service from decades ago. Dr. Chun stood slightly apart from the other students. Her eyes kept drifting to Vincent, then to the young veteran in Bay 9. Something about the situation clearly bothered her, but she remained silent. Westbrook moved to Vincent's bedside. The old man's eyes were closed, but his breathing pattern indicated full consciousness. Too controlled, too measured for actual sleep. I know you're awake. Westbrook's tone was almost amused. Your respiratory rate is too consistent. Real sleep has variation. But I suppose you wouldn't know that with your, what did you claim, Navy corpsman training. Vincent opened his eyes. The gray gaze was steady, calm, completely unaffected by the mockery. Navy SEAL, sir. Combat médic. 23 years. The students shifted uncomfortably. There was something in the old man's voice. A quiet certainty that didn't match the dismissive narrative Westbrook was constructing. Westbrook laughed. Actually laughed out loud. Of course. Not just Navy. Not just a corpsman. A SEAL. Because why claim something modest when you can claim to be Special Forces? He turned to the students. This is classic. Note how the delusion escalates when challenged. First it's just training. Then it's specialized training. Soon he'll probably tell us he has a Medal of Honor hidden in his pocket. Vincent's expression didn't change. No, sir. No Medal of Honor. But I did receive 3 Navy Crosses and 2 Silver Stars over the course of my career. His voice remained level, factual, like he was reciting weather data rather than the nation's highest combat decorations. One of the male students, a thin young man with thick glasses, spoke up hesitantly. Dr. Westbrook, shouldn't we at least verify? I mean, if he's telling the truth. Westbrook cut him off with a sharp gesture. If he's telling the truth, then why is he homeless? Why is he in this condition? Use critical thinking, Dr. Park. Navy SEAL combat medics with multiple decorations don't end up collapsed on sidewalks covered in infected wounds. Vincent's jaw tightened almost imperceptibly. That's not entirely accurate, Doctor. Many veterans end up exactly where I am. The system doesn't always work the way it should. PTSD, grief, loss, they don't care about your service record. His voice dropped lower. Sometimes the medals make it worse. Sometimes they remind you of everyone you couldn't save. The honesty in his voice created a moment of uncomfortable silence. Even Westbrook paused, wrong-footed by the emotional truth in the statement. But he recovered quickly. Regardless of your personal story, you're exhibiting signs of altered mental status, delusions of grandeur, refusal of appropriate medical treatment, and, he gestured toward Bay 9, inappropriate fixation on another patient. That young man has been evaluated by qualified physicians. He's stable. Your insistence otherwise is concerning. Vincent's eyes moved to Bay 9. The young veteran, Jake, was awake now, talking to a nurse, trying to smile despite obvious discomfort. But Vincent saw what the monitors weren't showing yet. The way Jake's hand kept moving to his left shoulder. The slight pallor creeping into his complexion. The way his breathing had shifted shorter, shallower, like deep breaths hurt. With respect, Doctor, That patient's blood pressure has dropped 4 points in the last 20 minutes. His heart rate is compensating, up 6 beats per minute. He's guarding his abdomen. Those are early signs of internal bleeding. Westbrook's face flushed red. You don't have access to that patient's charts. You can't even see the monitors from here. You're making assumptions based on nothing. Vincent's voice remained maddeningly calm. I can see him from here, sir. I can see the way he moves, the way he breathes. I've seen internal bleeding hundreds of times. In the field, in conditions far worse than this. The signs are consistent. Dr. Chen stepped forward. She had been watching Jake too. Dr. Westbrook, I think we should at least recheck his vitals. Just to be safe. Westbrook rounded on her. Dr. Chen, you will not let a delusional, homeless man dictate patient care protocols. That patient has been examined. He has a scheduled CT scan in 2 hours. We are following proper procedure. Do you understand? Yes, doctor. But Chen's eyes still drifted to Jake's bay. Westbrook turned back to Vincent. His voice had gone cold now. The mockery replaced with something sharper. You seem to think you're still some kind of hero. Still saving lives. Still relevant. But look at yourself. You're a broken-down old man who can't even take care of himself. You refused help. You ended up here. And now you're trying to practice medicine without a license based on training from what, 30 years ago? 40? Vincent's hands, resting on his chest, didn't move. But something flickered in his gray eyes. Not anger. Something sadder. Understanding, maybe, or recognition of how far he had fallen. I'm not trying to practice medicine. Doctor, I'm trying to save a life. There's a difference. The difference, Westbrook shot back, is that you're not qualified to do either anymore. Whatever you were, whatever you claim you were, you're not that person now. You're a homeless man with delusions, and I'm done entertaining them. He looked at the charge nurse. Get security. I want to move to a holding bay until psych arrives. And make sure he has no line of sight to other patients. His obsessive behavior is becoming a liability. The nurse hesitated. Dr. Westbrook, he's been cooperative. He hasn't made any threats or... Now, Westbrook's voice cracked like a whip. As the nurse moved to make the call, Vincent spoke again. His voice was softer now, but it carried across the bay. You're making a mistake, doctor. That young man is going to crash. And when he does, you're going to need help. I'm offering it now, before it becomes an emergency. Westbrook leaned down, close to Vincent's face. His voice was low, meant only for Vincent's ears, but the students were close enough to catch it. I don't need help from a fraud. I don't need advice from a delusional drunk. And I certainly don't need some washed-up has been telling me how to do my job. You want to help? Accept the psych evaluation. Take the medications. And shut up. He straightened, adjusted his white coat, and turned to the students. Remember this case. Altered mental status can present in many forms. Sometimes it's aggression. Sometimes it's withdrawal. And sometimes, as you see here, it's delusions of expertise and inappropriate concern for other patients. The key is recognizing it and managing it appropriately. The students followed him away from Vincent's bay, all except Dr. Chen, who lingered for a moment. She looked at Vincent, then at Jake, then back at Vincent. How long? She asked quietly. Vincent met her eyes. 90 minutes. Maybe less. Watch for increased restlessness, worsening referred shoulder pain, continued blood pressure decline. If he starts showing abdominal rigidity or his pressure drops below 90 systolic, he needs imaging immediately. Don't wait for the scheduled scan. Chen nodded once, then hurried to catch up with the others. Vincent closed his eyes again. His ribs throbbed with each breath. The infections in his hands pulsed with their own separate rhythm of pain. Every part of his body screamed for relief, for the morphine that would dull the edges, for the escape that oblivion promised. But he wouldn't, because across that corridor, a young man who looked like Ryan was dying. Slowly, quietly, while monitors lied and doctors dismissed concerns, and time ticked away. Vincent had failed once. The memory was sharp as broken glass. Ryan's last deployment. The promises Vincent had made. Stay safe, document. I'll need you there. And Vincent hadn't been there. Hadn't seen the signs. Hadn't been able to prevent the catastrophic loss. He wouldn't fail again. Security arrived 10 minutes later. Two officers in dark uniforms. Professional, polite, but firm. Sir, we need to move you to another bay. Doctor's orders. Vincent didn't resist, didn't argue, just nodded and allowed them to wheel his gurney to a holding area. A smaller bay, isolated, where he couldn't see Bay 9, couldn't see Jake, but he could hear the monitors, could hear the nurses talking, could hear when Jake's voice got a little tighter, a little more strained. Vincent lay in the isolated bay and counted heartbeats. His own, steady despite everything, trained to stay calm under pressure, trained to function when others panicked. Still here, son, he whispered to the ceiling. Still watching, still ready. And in approximately 73 minutes, when Jake's spleen finally ruptured completely and the monitors started screaming, Vincent Harlow would prove that some training never dies, that some men never stop being who they were trained to be, even when the world had forgotten them, even when they had forgotten themselves. The smell of diesel and blood, that was what pulled Vincent back, not to the isolated holding bay in County General Hospital, but to Afghanistan, Kandahar Province. August 14th, 2009. The night everything changed. Vincent was 37 years old then, at the peak of his career. Senior Chief Petty Officer, SEAL Team 3, combat medic with a reputation that extended beyond his unit. When things went catastrophically wrong, when conventional medicine wasn't enough, they called for Doc Harlow. The mission had been routine. Extract a high-value target from a compound 12 clicks outside the city. Intelligence said minimal resistance. Intelligence was wrong. They hit the compound at 0100. 6 SEALs, 1 target, in and out in 15 minutes. That was the plan. The RPG came from a building they had cleared twice. Vincent had been on overwatch, providing medical support from a defensive position. He heard the explosion, felt the shock wave even from 60 meters out, saw the building collapse in a cloud of dust and fire. 3 men trapped inside, 2 wounded, 1 critical. The critical one was Lieutenant Commander James Morrison, 29 years old, son of Senator Richard Morrison. A detail they weren't supposed to know, but everyone did. The kind of detail that meant this mission had political weight beyond the standard rescue operation. Morrison had taken shrapnel to the abdomen and chest. Massive trauma, arterial bleeding. Without immediate intervention, he had maybe 6 minutes before hemorrhagic shock became irreversible. Vincent went in alone. The rest of the team provided suppressing fire while he moved through hostile territory to reach the collapsed building. Bullets chewed through concrete around him. The air was thick with dust and smoke and the copper smell of blood. He found Morrison in what was left of a back room, conscious, eyes wide with pain and fear, blood pooling beneath him in quantities that made Vincent's training kick into overdrive. Doc, Morrison's voice was thin, thready. Am I going to die here? Vincent dropped to his knees beside him. Not if I have anything to say about it, sir. The medical kit came open. Vincent's hands moved with practiced precision. Assess, stabilize, prepare for transport. But Morrison's injuries were catastrophic. The shrapnel had torn through his spleen and nicked his hepatic artery. He was bleeding internally and externally. Standard protocol said morphine first. Manage the pain. Keep the patient calm. But Vincent couldn't do that. The compound was still hot. Enemy fighters were maneuvering for position. The team was under fire. If Vincent dulled his senses with painkillers, if he let himself slip even slightly, he might miss the sound of approaching hostiles, might not hear the warning that would save both their lives. So he worked without morphine, without anything to dull the screaming pain in his own shoulder where he had taken a grazing round on the way in. He needed every sense sharp, every reflex ready. I need to operate, sir. Vincent's voice was calm, clinical. Here, now. I don't have anesthesia. This is going to hurt. Morrison's eyes found his. The lieutenant commander was young, but he wasn't stupid. He understood what Vincent was saying, understood the choice that wasn't really a choice. Do it. Document. Vincent operated in that collapsed building for 43 minutes, with bullets hitting the walls, with enemy fighters trying to flank their position, with Morrison screaming until his voice gave out, and then whimpering, and then going silent, because the pain was so immense that sound became impossible. Vincent's hands never shook, never hesitated. He clamped the arterial bleed, packed the wounds, stabilized Morrison enough for transport. And he did it all while staying alert enough to hear footsteps approaching from the east corridor, alert enough to grab his sidearm and put down 2 hostiles who made it past the perimeter, alert enough to call in the exact coordinates for air support that turned the tide. When a medevac finally arrived, Morrison was alive. Barely, but alive. Vincent rode with him on the helicopter, held pressure on the wounds, monitored vitals, kept him breathing through sheer force of will and expertise. Morrison survived, made a full recovery, went on to have a distinguished career, got married, had kids. Vincent had seen the photos in the newspaper years later. The senator's son at his wedding, smiling, healthy, alive. That operation earned Vincent his second Navy Cross. The citation mentioned his medical expertise under fire, his ability to perform complex trauma surgery in impossible conditions, his courage in treating a critically wounded officer while under direct enemy attack. What the citation didn't mention was the cost, the nightmares that followed, the way Vincent's hands shook for weeks afterward whenever he tried to sleep, the memory of Morrison's screams that echoed in his head during quiet moments. The citation didn't mention that Vincent never took morphine again, not for his own injuries, not when he broke his collarbone in a training accident 2 years later, not when he took shrapnel in his leg during his final deployment. Never again, because morphine dulled the edges, made you slow, made you miss things. And if you missed things in combat, people died. Vincent had learned that lesson in blood and fire, had carried it for 13 years after that night, carried it through retirement, through Ryan's death, through Sarah's, carried it into the streets where it didn't matter anymore because there was no one left to save. Except now there was. A young veteran across the corridor who looked like Ryan, who had the same jawline, the same age, the same way of trying to be brave while the world fell apart around him. Vincent's eyes opened in the holding bay. The memory faded, but the lesson remained. Sharp, clear, uncompromising. He could hear Jake's voice from the main emergency department, talking to a nurse. The words were indistinct, but the tone was wrong. Tighter, more strained, pain breaking through the brave facade. Vincent checked his internal clock. 62 minutes since he had warned Westbrook. 62 minutes of watching Jake's condition deteriorate while everyone assumed stability meant safety. The nurse who had moved Vincent to the holding bay, an older woman named Patricia, came in to check his vitals. Her hands were gentle despite the circumstances. "How are you feeling?" she asked. Vincent met her eyes. "Honestly, ma'am, it doesn't matter how I feel. What matters is that young man out there. Has anyone rechecked his blood pressure?" Patricia hesitated. "I shouldn't be telling you this. But yes, Dr. Chun ordered another set of vitals 20 minutes ago. His pressure dropped to 92/60. Vincent's jaw tightened. And what did Dr. Westbrook say? That it was still within acceptable range. That the scheduled CT scan would happen in. She checked her watch. 90 minutes. Vincent's voice was quiet but urgent. He doesn't have 90 minutes. Maybe not even 60. His spleen is bleeding. Slowly now, but it's going to rupture completely. When it does, his pressure will crash. He'll go into shock. Every minute between rupture and surgery decreases his survival rate. Patricia looked at him for a long moment. "Why do you care so much? You don't know him." Vincent's hand moved to his chest, to where dog tags used to hang, to where the memories lived. "Because I had a son, a Marine, 24 years old. He died in Afghanistan. IED. I wasn't there. Couldn't save him. Couldn't do anything but identify his body and fold his flag." His voice cracked slightly. "That boy out there reminds me of Ryan. Same age, same service, same way of pretending he's fine when he's not. I fail my son. I won't fail him." Patricia's expression softened. She reached out and squeezed Vincent's hand. The gesture was brief but genuine. "Let me see what I can do." She left the bay. Vincent heard her talking to someone. Couldn't make out the words, but recognized Dr. Chen's voice responding. 5 minutes passed. Then Chen appeared in the holding bay entrance. She looked exhausted, worried, young enough to still doubt herself, but experienced enough to trust her instincts. I convinced Dr. Westbrook to move up the CT scan. She spoke quickly, quietly, told him I wanted to rule out appendicitis definitively before the end of shift. He approved it to get me to stop bothering him. Jake's going to imaging in 15 minutes. Vincent felt something loosen in his chest. A small relief. Not enough, but something. Thank you, doctor. Chin stepped closer. Can I ask you something? Off the record? Vincent nodded. Were you really a SEAL? Really a combat medic? Vincent's eyes held hers. 23 years. 3 Navy Crosses. 2 Silver Stars. Bronze Star with V device. Purple Heart with 3 clusters. I performed surgery in firefights. Treated mass casualty events in conditions you couldn't imagine. Pioneered trauma protocols that are still taught today. His voice dropped. And then I lost my son and my wife, and I couldn't function anymore. Couldn't look at my decorations without seeing everyone I couldn't save. So I walked away. From everything. Why are you telling me this? Because that boy deserves someone who believes me. Someone who will act if things go wrong. Dr. Westbrook won't. His pride is in the way. But you, Vincent, met her eyes. You're still young enough to trust your instincts over politics. Chin was quiet for a moment. Then she nodded once. I'll be watching. If anything changes, I'll respond immediately. Good. Because when his spleen ruptures, you'll have less than 3 minutes to get him to surgery. 3 minutes between life and death. Don't waste them arguing with Westbrook. Chun left. Vincent settled back against the thin mattress. His ribs screamed. His hands throbbed. Every part of his body demanded relief. Demanded the morphine that would make it all fade away. But Vincent had learned 13 years ago in a collapsed building in Kandahar that some things mattered more than comfort. That staying sharp saved lives. That pain was just pain, but death was forever. Still here, Ryan, he whispered. Still sharp. Still ready. And in the main emergency department, Jake was being prepared for transport to imaging. The CT scan that might catch the bleed before it became catastrophic. Might give them the warning they needed. Or might be too late. Vincent closed his eyes and counted heartbeats. His own. Steady. Trained. Ready for whatever came next. Still here, son. Still trying to save them. One young veteran at a time. The psychiatric evaluation team arrived 40 minutes later. 2 people. A resident psychiatrist named Dr. Allen, young and earnest, and a social worker named Karen Mitchell, who looked like she had seen everything twice and believed none of it. Vincent watched them enter the holding bay. Noted their body language. The psychiatrist approached with clinical detachment. The social worker hung back, already forming conclusions before a single word was spoken. Mr. Harlow, Dr. Allen began, settling into a chair beside the gurney. I'm Dr. Robert Allen. I've been asked to conduct a psychiatric evaluation. Do you understand why I'm here? Vincent's voice was calm. Dr. Westbrook believes I'm delusional because I refused pain medication and expressed concern about another patient's condition. Allen nodded, making notes on his tablet. And why did you refuse pain medication? Vincent had answered this question a dozen times already, but he answered it again with the same measured patience. Because I needed to stay alert. To monitor a patient I believe is experiencing internal bleeding. Pain medication would have dulled my ability to observe and respond. Allen's pen paused. You're not a physician at this hospital. Why do you feel responsible for monitoring other patients? Because I have the training to recognize the signs. And because nobody else seemed to be looking. What training specifically? 23 years as a Navy SEAL combat medic. Senior Chief Petty Officer. Specialized in trauma medicine under combat conditions. I've treated hundreds of casualties. Performed emergency surgery in the field. Pioneer protocols that are still used today. The social worker, Mitchell, shifted her weight. Made a small sound that might have been skepticism. Allen continued writing. And you believe this training from, he checked his notes, service that ended over a decade ago, qualifies you to override the medical judgment of current emergency department physicians? Vincent's jaw tightened slightly. I'm not trying to override anyone, doctor. I'm trying to prevent a young man from dying because early warning signs are being dismissed. There's a difference between overriding judgment and providing information that might save a life. Alan leaned back. Mr. Harlow, I've reviewed your presentation. Homeless, multiple trauma, infections, severe dehydration. These are all consistent with someone in crisis. Sometimes when people are in crisis, they develop, he chose his words carefully, compensatory narratives. Stories that make them feel valuable, important, needed. Vincent's eyes, gray and steady, held Alan's gaze. You think I invented a military career to feel important? I think it's possible you're experiencing a psychological response to trauma and homelessness. That you've constructed a narrative where you're a hero instead of someone who needs help. Vincent was quiet for a long moment. When he spoke, his voice carried a weight that made even Mitchell look up. Dr. Allen, I understand how this looks. I understand that a homeless man claiming to be a decorated SEAL sounds exactly like the kind of delusion you're trained to identify. But consider this. Everything I've told you can be verified. My service record exists. My decorations are documented. The protocols I developed are published in military medical journals. I'm not asking you to take my word for it. I'm asking you to check. Alan made more notes. We can certainly request verification of service. But that process takes time. Right now, I need to assess whether you're a danger to yourself or others, and whether you're competent to make your own medical decisions. I'm not a danger to anyone. I'm trying to help. By refusing treatment? Mitchell spoke for the first time. Her voice was sharp, skeptical, because that's what it looks like. Someone with a martyr complex. Someone who thinks suffering makes them noble. Vincent's expression didn't change. I've had worse injuries than these. Treated myself and others in conditions far worse than this hospital. Pain is just information. It tells you what's damaged. It doesn't require medication unless it interferes with function. And refusing pain medication doesn't interfere with function? Alan asked. Not if you're trained to work through it. SEALs learn to compartmentalize pain, to function under conditions most people couldn't imagine. It's not martyrdom. It's training. Mitchell crossed her arms. So you're claiming superhuman pain tolerance because of Navy training from decades ago. Vincent's voice stayed level despite the provocation. I'm claiming that with proper training, pain becomes manageable. And that in this specific situation, staying alert without medication was more important than comfort. Because that young man's life depended on someone watching. Someone who knew what to look for. Alan closed his tablet. Mr. Harlow, I'm going to recommend a 72-hour psychiatric hold. Not because I think you're dangerous, but because I believe you need comprehensive evaluation and support. You're homeless, injured, refusing treatment, and fixating on a patient you have no relationship with. These are concerning behaviors that warrant further assessment. Before Vincent could respond, Dr. Chin appeared at the bay entrance. Her face was flushed. She had been running. Dr. Allen, I'm sorry to interrupt, but I need to inform you of a development. She looked at Vincent. The CT scan showed significant intra-abdominal bleeding, free fluid in the pelvis, splenic injury with active hemorrhage. The patient you were concerned about, she nodded at Vincent, is being prepped for emergency surgery right now. The room went silent. Alan looked at Chun, then at Vincent, then back at Chun. This is the patient Mr. Harlow claimed was bleeding internally? Alan's voice was carefully neutral. Yes. Chen's voice was firm, and his assessment was accurate. The bleed was slow, easy to miss on initial examination, but it was there, exactly as he described. If we had waited for the originally scheduled scan time, Jake's condition would have deteriorated significantly, possibly catastrophically. Mitchell's arms uncrossed. She looked at Vincent with new eyes, something between confusion and reluctant respect. Alan set down his tablet. How did you know? He asked Vincent directly. You had no access to imaging, no access to labs. You couldn't even see the patient from this bay. Vincent's response was quiet, simple. I've seen it hundreds of times. The way he moved, the referred shoulder pain, the gradual blood pressure decline, the positioning he adopted to ease abdominal pressure. In the field, you learn to read signs because you don't have imaging or labs. You have observation and experience. I observed. I knew what I was seeing. Alan was quiet for a moment. Then he picked up his tablet again and made several notes. His tone had changed. Less clinical detachment. More genuine curiosity. Mr. Harlow, I'm going to recommend we verify your service record before proceeding with any psychiatric hold. If what you're saying is accurate, if you do have this background, then your behavior isn't delusional. It's exactly what someone with your training would do. Mitchell spoke again, her skepticism tempered now. You really did all of that? The SEAL training? The combat medicine? Vincent nodded once. And more. But it doesn't matter what I did decades ago. What matters is that young man is getting the surgery he needs. That's all I wanted. Chin stepped further into the bay. I spoke with Jake before they took him to the OR. Told him someone had been watching out for him. He asked who. I told him about you. He wanted me to say thank you. Vincent's expression softened. Just slightly. The hard edges of constant vigilance easing for a moment. What's his full name? Jake Chun. Nori Laschin. She smiled slightly. He's 25. Iraq veteran. Came in complaining of abdominal pain after a fall 3 days ago. Thought it was just bruising. Vincent closed his eyes briefly. 25. Same age Ryan would have been if he had lived. If the IED hadn't torn him apart. If Vincent had been there. If the universe had been kinder. He'll be okay, Chin said softly. The surgeon is excellent. They caught it in time because of you. Vincent opened his eyes. His voice was rough. I just did what I was trained to do. Alan stood, tucking his tablet under his arm. I'm going to hold off on the psychiatric recommendation pending verification. But Mr. Harlow, you need to accept some treatment. The infections in your hands need antibiotics. The dehydration needs addressing. You can refuse pain medication, but you can't refuse everything. Vincent nodded slowly. I understand, doctor. I'll accept treatment. Now that Jake's safe, I can rest. Chin smiled. I'll make sure you get what you need. And she paused. Thank you. For seeing what we missed. For caring about someone you didn't know. He reminded me of my son, Vincent said quietly. Same age. Same service. I couldn't save Ryan, but I could save Jake. How to save Jake. The weight of that statement settled over the room. Even Mitchell looked away, something like compassion crossing her face. Alan and Mitchell left to file their reports. Chun stayed for a moment longer. Your son, she said softly. What happened? Afghanistan. 2011. IED. Vincent's voice was flat, emotionless. The only way to talk about it without breaking. He was a Marine, 24 years old. I taught combat medicine for years. Saved hundreds. But I couldn't save him. Wasn't there. Couldn't do anything but bury him. I'm sorry. Vincent nodded. Me too. Chun left. The holding bay was quiet again. But the quality of the silence had changed. No longer isolation. No longer punishment. Just a moment of peace after the storm. Vincent lay back and finally allowed himself to feel the exhaustion. The pain. The weight of 7 years on the streets. The memories of everyone he couldn't save and the one he had. Still here, Ryan, he whispered. Save one today. One more young Marine who gets to go home. And for the first time in 7 years, Vincent Harlow allowed himself to believe that maybe, just maybe, staying alive had been worth it after all. Dr. Westbrook returned to the holding bay an hour later. His white coat looked less pristine now. A coffee stain marked the sleeve. His expression carried the particular tension of someone whose authority had been challenged and found wanting. He stood at the entrance for a long moment, not speaking, just looking at Vincent with something that might have been anger or might have been fear or might have been both. Vincent met his gaze calmly. Waited. So, Westbrook finally said. His voice was controlled but tight. It appears you were correct about the patient in Bay 9. Splenic injury with active hemorrhage. He's in surgery now. Vincent nodded, but said nothing. Westbrook stepped closer. The movement was aggressive. Territorial. Like a dog reasserting dominance after being corrected. You got lucky. Making a diagnosis from across the room with no access to vitals, no labs, no imaging. That's not medicine. That's a guess that happened to be right. Vincent's voice remained level. It wasn't a guess, doctor. It was pattern recognition based on decades of experience. The same way you diagnose patients based on your training. Mine just happens to be different from yours. Different. Westbrook's laugh was sharp, humorless. You're homeless. You're lying in a hospital bed covered in infected wounds because you can't even take care of yourself. That's not different. That's failure. The words were designed to wound. Vincent could see it in Westbrook's eyes. The need to reassert superiority, to diminish what had happened, to make Vincent small again. But Vincent had been called worse things by better people, had been shot at by enemies who wanted him dead, had buried his son and his wife and his entire life. Words from an insecure doctor couldn't touch the places that already hurt. You're right, Vincent said quietly. I did fail. Fail my family. Failed myself. Failed to cope with loss in any healthy way. I'm homeless because I chose to be. Because I couldn't live with what I had become. His eyes never left Westbrook's. But failing at life doesn't mean I forgot how to save lives. Those are separate things. Westbrook's jaw worked. He wanted to argue, wanted to dismiss. But the evidence was in surgery. The patient Vincent had identified was alive because someone had listened. Dr. Chun told me you claim to be a Navy SEAL, that you have multiple decorations, that you pioneered trauma protocols. Westbrook's tone made it clear he didn't believe any of it. It's not a claim, doctor. It's documented fact. You could verify it in less than 10 minutes if you wanted to. Westbrook pulled out his phone. Fine, let's do that. What's your full name and service number? Vincent recited both, added his date of birth and the years of his service. Westbrook typed into his phone, probably searching military databases, probably expecting to find nothing, probably ready to declare victory when the homeless man's story fell apart. The change in Westbrook's expression was subtle but unmistakable, the skepticism giving way to something else. Confusion first, then shock. He scrolled. Read. Scroll more. His face went pale. This says Westbrook's voice had lost its edge, that you received 3 Navy Crosses, 2 Silver Stars, a Bronze Star with V device, Purple Heart with 3 oak leaf clusters. You're listed as having developed multiple trauma protocols that are still in active use. You taught at the Naval Medical Center. You were Senior Chief Petty Officer. SEAL Team 3. Vincent said nothing, just waited. This says you performed emergency surgery under fire to save the life of Lieutenant Commander James Morrison in 2009. That you operated without anesthesia in a hostile compound while under direct enemy attack. Westbrook looked up from his phone. Morrison, as in Senator Morrison's son. Yes, sir. Westbrook's hand trembled slightly. He set the phone down on the small table beside Vincent's gurney. Why didn't you tell me this earlier? Why didn't you show me proof? You didn't ask for proof, doctor. You made assumptions based on appearance. And nothing I said would have changed your mind. You had already decided who I was, what I was worth. A homeless man's credentials wouldn't have mattered to you an hour ago. The truth of that statement hung between them. Westbrook couldn't deny it. They both knew it. What happened to you? Westbrook's voice was quieter now, almost human. How does someone with your record end up on the streets? Vincent was quiet for a moment, deciding how much to share, how much this man had earned the right to know. I had a son, Ryan, Marine, died in Afghanistan in 2011. IED. He was 24. Vincent's voice stayed flat, emotionless, the only way to get through it. My wife, Sarah, died 2 years later. Heart attack, but really grief. I couldn't function after that. Couldn't stay in the house. Couldn't look at the photos. Couldn't accept help from people who kept saying it would get better. So I left, walked away from everything. Pension, home, life. Been on the streets for 7 years. Westbrook absorbed this. His earlier aggression completely gone now, replaced by something uncomfortable. Maybe shame, maybe recognition of his own cruelty. He started then stopped. Tried again. I made assumptions about who you were, what you were capable of. I was wrong. Vincent's eyes held his. Yes, you were. The patient, Jake. When you saw him, what did you see? Vincent's expression softened slightly. I saw my son. Same age Ryan would have been if he had lived. Same service background. Same way of trying to be tough while scared. I saw someone who needed help and nobody was listening. I couldn't save Ryan, but I could save Jake. How to save Jake? Westbrook was quiet for a long moment. Then he pulled up a chair, sat down. The posture was different now. Not adversarial, almost supplicant. Walk me through it. What you saw. How you knew. Vincent shifted slightly on the gurney. His ribs protested, but he ignored them. The way Jake moved, favoring his left side, the hand kept going his left shoulder. That's referred pain from diaphragmatic irritation. Classic for splenic injury. His skin had a slight pallor. His eyes showed pain he was trying to hide. When I saw his vitals, blood pressure trending down, even though it was still in normal range, heart rate compensating upward, it all fit the pattern. But you couldn't see the monitors from the holding bay. No, but I could hear them. Could hear the beep rate changing. Could hear nurses discussing numbers quietly. And I could see Jake through the gap in the curtain when people moved. Enough to track his positioning, his breathing, his color. Westbrook shook his head slowly. That's not how we're trained to practice medicine. We rely on data. Tests. Imaging. In a field hospital with mass casualties and no power, you don't have imaging. You have your hands, your eyes, your experience. You learn to read patients the way trackers read trails. Every sign matters. Every change means something. Vincent paused. I'm not saying your way is wrong, doctor, but mine isn't wrong either. Just different. I called you delusional. Threatened you with psychiatric holds. Isolated you. Yes, you did. I'm sorry. The words sounded like they cost Westbrook something. I was wrong. About everything. Vincent studied him for a moment, then nodded. Apology accepted. You made assumptions based on incomplete information. That's human. What matters is whether you learn from it. Westbrook stood, adjusted his coat. The coffee stains still marked the sleeve, but he seemed less concerned with appearance now. I'm going to personally oversee your treatment. Antibiotics for the infections. For fluids for the dehydration. We'll get your ribs properly wrapped. And he met Vincent's eyes. I won't push pain medication. I understand now why you refused. Thank you, doctor. Westbrook moved toward the bay entrance. Paused. Look back. One more thing. When Jake gets out of surgery, when he's in recovery, would you be willing to see him? He asked about you. Said he wanted to thank the person who saved his life. Vincent's throat tightened. He nodded, not trusting his voice. After Westbrook left, Vincent lay in the quiet bay. The monitors beeped their steady rhythm. The four dripped antibiotics into his system. The pain in his ribs was a constant throb, but manageable. Familia. He thought about Jake and surgery, about Ryan in Afghanistan, about all the young warriors he had treated over 23 years. Some he had saved, some he had lost. Each one a name, a face, a person who mattered. Still here, Ryan, he whispered. Still saving your brothers. Still trying. Nurse Patricia came in to check his vitals. Her touch was gentle as she adjusted the four. Word spreading, she said quietly. About what you did. About who you are. The staff is talking, saying we have a real hero in Holding Bay 3. Vincent shook his head. I'm not a hero, ma'am. Just a medic who did his job. Patricia smiled. That's what heroes always say. She checked the four-line. The surgeon came out of the ER 20 minutes ago. Jake's stable. Surgery went well. They removed his spleen, repaired some vascular damage, but he's going to make a full recovery. The relief was physical. Vincent felt it in his chest, in the tension releasing from muscles that had been clenched for hours. Thank you for telling me. Patricia patted his hand. The same gesture she had given earlier. Rest now. You've earned it. After she left, Vincent finally allowed his eyes to close. Really close. Not the half-alert state he had maintained for hours, but actual rest. Jake was safe. The mission was complete. The young Marine would go home. And Vincent Harlow, for the first time in 7 years, allowed himself to sleep without nightmares. Because tonight, at least, he had saved one. Had been there when it mattered. Had proven that some things, once learned, could never be forgotten. Even when everything else was lost. Vincent woke to voices outside the holding bay. Lo, urgent. The kind of conversation that carried weight. He recognized Dr. Westbrook's voice first. Then another. Deeper. Older. Carrying the particular authority that came from rank and experience. I don't care what your excuse is, Dr. Westbrook. The unfamiliar voice was cold. Precise. You nearly killed that young man through negligence and arrogance. If it weren't for a homeless veteran you tried to have committed, Jake Shun would be dead right now. Vincent opened his eyes, saw two figures at the bay entrance. Westbrook, looking smaller somehow, and a man in his 60s wearing a dark suit. Military bearing obvious in his posture. Someone accustomed to command. "Sir, I made an error in judgment," Westbrook was saying. "But I've apologized to Mr. Harlow, and—" "An error in judgment." The older man's voice cut like a blade. "You dismissed a decorated combat veteran's medical assessment because he was homeless. You threatened him with psychiatric holds. You isolated him to prevent him from helping. That's not an error in judgment. That's systematic failure driven by prejudice." The older man stepped into the bay. His eyes found Vincent. There was something there. Recognition, maybe, or respect. "Senior Chief Harlow," the man said. His voice had changed. Softer now. Respectful. "I am Colonel Richard Morrison, United States Marine Corps, retired." Vincent's breath caught. Morrison, the name from 13 years ago. The compound in Kandahar. The senator's son bleeding out on a dirt floor. "Your son," Vincent said quietly. Morrison nodded. "James. He's a captain now. Naval aviator. Married. 2 kids. Living a life he wouldn't have had without you." He stepped closer to the gurney. "I've been trying to find you for years, Senior Chief. After you retired, you disappeared. No forwarding address. No contact information. It was like you vanished." "I did vanish, sir. Intentionally." Morrison pulled up the chair Westbrook had used earlier. Sat down. His eyes took in Vincent's condition. The worn clothes. The infected hands now bandaged. The obvious malnutrition. The marks of 7 years on the streets. "James calls me every year on August 14th. The anniversary of the day you save his life. He tells me about his career, his family, everything he's grateful for. And every year I wonder where you are. Whether you're okay. Whether you know how many lives you touched." Vincent's voice was rough. "I'm glad your son is well, sir. He deserved to make it home. They all did." Morrison's expression hardened slightly. "But not everyone did make it home. Your son. I read the report. Ryan Harlow, Marine Lance Corporale, qui a Afghanistan, 2011. Vincent looked away. "Yes, sir. And your wife, Sarah." 2 years later. Vincent nodded. Couldn't speak. Morrison was quiet for a moment. When he spoke again, his voice carried the weight of someone who understood loss. "I'm sorry for your losses, for what you've endured. And I'm sorry we failed you. The system, the VA, all of us who should have been there. The system didn't fail me, Colonel. I walked away from it. Refused help. Chose this." Morrison shook his head. "The system failed you long before you walked away. When it didn't have adequate support for combat trauma. When it made you wait months for appointments. When it lost your paperwork. I've read your file, Senior Chief. You tried to get help. Multiple times. The system made it so difficult that walking away seemed easier." Vincent met his eyes. "How did you find me?" Morrison pulled out his phone. Showed Vincent a screenshot. A news article. "Local emergency room. Doctor learns hard lesson about assumptions." The story detailed Jake's case. Mentioned a homeless veteran who had accurately diagnosed a life-threatening condition. Quoted Dr. Chun. Referenced the verification of Vincent's service record. The article went viral this morning, Morrison said. Shared thousands of times. A friend sent it to me. I recognized the name. Called the hospital. Drove 3 hours to get here. Why? Vincent asked. Why come all this way? Because 13 years ago, you saved my son's life when nobody else could. You operated in a firefight without anesthesia. Held that position for 43 minutes while under direct attack. Kept James alive when by all rights he should have died. Morrison's voice thickened. And then you vanished. No contact. No way to thank you. No way to show you what your sacrifice meant. It wasn't a sacrifice, sir. It was my job. Morrison smiled slightly. That's exactly what James said you would say. He stood, walked to the small window in the bay, looked out at the parking lot. Do you know what he does every August 14th? Besides calling me? No, sir. He donates to veteran organizations, mental health services, homeless outreach programs, suicide prevention hotline. Last year alone, he donated $50,000. In your name. The Vincent Harlow Memorial Fund, he calls it. Even though you're not dead. He just assumed you must be, since nobody could find you. Vincent's chest tightened. He didn't need to do that. He needed to do exactly that. Morrison turned back. Because you gave him a life, a future, a chance to be a husband and father. You gave him everything. And he spent 13 years trying to honor that gift by helping other veterans. Veterans like you. I don't need help, Colonel. Morrison's expression hardened. With respect, Senior Chief, yes you do. You're homeless, malnourished, infected wounds, fractured ribs, living on the streets for 7 years because you couldn't process your grief. That's not strength. That's suffering. And you don't have to suffer alone anymore. Vincent looked at his hands. The bandages covering the infections. The scars from decades of hard use. The tremor that came with age and exposure. I don't deserve help, he said quietly. I failed Ryan. Failed Sarah. Failed to be there when they needed me most. Morrison sat down again. Leaned forward. His voice was gentle but firm. Senior Chief, I'm going to tell you something James told me when he came home from Afghanistan. He said the hardest part wasn't the injury. Wasn't the pain. It was watching you work on him. Seeing the look in your eyes. He said you looked at him like he was the most important person in the world. Like saving him mattered more than your own life. Vincent remembered that look. Remembered Morrison's face. Young. Scared. Bleeding. He said he saw that same look in photographs of combat medics throughout history. Morrison continued. The ones who ran into fire to drag out wounded. The ones who stayed with dying soldiers so they wouldn't be alone. The ones who carried other people's trauma for years afterward. He said you looked at him the way those medics looked at everyone they couldn't save. Like each loss was personal. It was personal, Vincent whispered. They all were. I know. Morrison's hand rested on Vincent's shoulder. A brief touch. Respectful. And that's why you need help. Because you've carried too much for too long. Because saving lives doesn't mean you have to lose your own. Vincent felt something breaking. Some wall he had built 7 years ago. Some barrier between the man he had been and the wreckage he had become. I don't know how to stop carrying it, he said. His voice cracked. Don't know how to put it down. You don't have to put it down alone. Morrison's voice was steady. Strong. James wants to help. I want to help. There are programs now. Real programs. Not VA bureaucracy. Places where combat veterans can heal together. Where the people running them understand what you've been through because they've been through it too. Vincent closed his eyes. Saw Ryan's face. Saw Sarah's. Saw Morrison bleeding in Kandahar. Saw Jake on the gurney. Saw all the faces of all the warriors he had treated and lost and saved and mourned. I am tired, Kenneth. So tired of fighting. Then stop fighting alone. Morrison stood. When they discharge you from here, you're coming with me. Not because you owe me. Not because James owes you. But because veterans take care of each other. That's what we do. That's who we are. Vincent looked up at him. At this man whose son he had saved. This stranger who had driven 3 hours because an article reminded him of a debt 13 years old. What if I can't do it? What if I fail again? Morrison smiled. Then we pick you up and try again. That's what brothers do. And make no mistake, Senior Chief. You saved my son's life. That makes you family. And family doesn't abandon family. Dr. Westbrook, still standing at the bay entrance, spoke for the first time in several minutes. For what it's worth, Mr. Harlow, I support this. You need proper care, proper support. And he met Vincent's eyes. You deserve it. Regardless of what you think you deserve, you've earned it 1,000 times over. Vincent felt the exhaustion again. The weight of 7 years. The accumulated grief. The pain that had nothing to do with fractured ribs and infected hands. Okay, he said quietly. Okay, I'll try. Morrison nodded. Good. That's all anyone can do. Try. And keep trying. His hand squeezed Vincent's shoulder once more. James is flying in tomorrow. He wants to see you. Wants to introduce you to his kids. Your godchildren, he calls them, even though you never knew they existed. Vincent's voice was barely audible. I'd like that. Morrison smiled. Good. Because those kids have heard stories about Uncle Vincent their whole lives. Tom had met the real man. After Morrison left to make arrangements, Vincent lay in the quiet bay. The monitors beeped. The four dripped. Outside, the hospital continued its endless rhythm of crisis and care. But something had shifted. Some possibility Vincent hadn't allowed himself to consider in 7 years. Maybe just maybe, there was a way forward that didn't end in an anonymous grave. A way that honored Ryan and Sarah not through suffering, but through living. Through helping others. Through accepting that surviving wasn't betraying the dead. Still here, son, Vincent whispered. And maybe, finally, that's okay. Maybe being here is enough. The next morning brought a commotion that rippled through the emergency department like a stone dropped in still water. Vincent heard it before he saw it. Voices. Footsteps. The particular energy that came when something important was happening. Dr. Chun appeared at his bay entrance first. Her eyes were bright with something that looked like excitement mixed with nervousness. "Mr. Harlow," she said, "there are some people here to see you. A lot of people, actually. Are you up for visitors?" Vincent had spent the night in actual sleep. Real rest. The antibiotics were working. The 4 fluids had rehydrated him. His ribs still hurt, but the sharp edge had dulled. He felt more human than he had in months. "Who is it?" he asked. Chun smiled. "You'll see." She stepped aside. The first person through was Jake Chun. No relation, she had said, but Vincent saw him now as if for the first time. Young, alive, moving carefully but moving. His abdomen was bandaged beneath the hospital gown, but his color was good. His eyes clear. Jake stopped at the foot of the gurney. His voice was quiet, respectful. "Sir, I'm Jake Chun. He paused, searching for words. "I'm alive because of you. The doctors told me what you did. How you saw what they missed. How you refused to give up even when they tried to silence you." Vincent's throat tightened. "You don't need to thank me, son. I'm just glad you're okay." Jake shook his head. "I didn't need to thank you. Because I have a little sister who still has a brother. Parents who still have a son. A girlfriend who still has," he smiled slightly, "whatever we are. All of that exists because you cared enough to watch. To see. To speak up." Before Vincent could respond, another figure appeared. Tall, lean, naval officer's uniform. Captain's bars on his shoulders. And a face Vincent recognized from 13 years ago. Older now, weathered by time and experience, but unmistakably the same. James Morrison stepped into the bay. His eyes found Vincent's and held them. For a long moment, neither man spoke. Then Morrison moved forward quickly, dropped to one knee beside the gurney. His hand found Vincent's, gripped it with the kind of strength that spoke of emotion barely contained. "Doc," Morrison's voice broke. "You're alive. You're really alive." Vincent stared at the man he had saved. The lieutenant commander who had become a captain. The senator's son who had bled on a dirt floor while bullets tore through walls. "Captain Morrison," Vincent managed. "You look well, sir." Morrison laughed, a sound caught between joy and tears. "Well, I'm well because of you." He stood, but didn't release Vincent's hand. "Do you know how many times I've looked for you? How many databases I've searched? How many inquiries I've made? Colonel Morrison said you've been trying to find me. Trying and failing. Until yesterday. Until you saved another life and the story went viral." James pulled out his phone, showed Vincent the screen. The article had been shared over 50,000 times. Comments flooded beneath it. Stories from other veterans. Other people who had been dismissed and underestimated. Other voices saying thank you to a man they had never met. "This story," James said, "is reaching millions of people. And every one of them is learning what I learned 13 years ago. That the measure of a man has nothing to do with his circumstances. Everything to do with his character." More people were appearing now, crowding the bay entrance. Vincent saw Colonel Morrison, saw nurses from the ER, saw Dr. Westbrook standing near the back, his expression unreadable. And then he saw the children. A boy, maybe 8 years old. A girl, perhaps 6. Both with dark hair and bright eyes. Both watching Vincent with the kind of wide-eyed curiosity that belonged to the young. James followed Vincent's gaze. Smiled. "Those are my kids. David and Emma." He gestured them forward. The children came shyly. Uncertain, they stopped at their father's side. "Kids," James said gently. "This is the man I've told you about. The hero who saved Daddy's life. This is Uncle Vincent." The little girl, Emma, looked up at Vincent. Her voice was small but clear. "Daddy said you're a real superhero. Like Captain America, but real." Vincent felt his eyes sting. Not a superhero, sweetheart. Just a medic who did his job. The boy, David, was bolder. He stepped closer. Dad says you operated on him during a gunfight. That you didn't have any medicine to make it not hurt. That you saved him even though bad guys were shooting. Vincent looked at James. You told him that? I told him everything. James's voice was firm, because they needed to understand that heroes aren't just in movies. That real people do extraordinary things. That courage looks like an old man refusing pain medication so he can save a stranger's life. David held out something. A drawing. Crayon on white paper. It showed a figure in military uniform. Hands reaching toward another figure on the ground. Bullets drawn as lines in the air. At the top, in careful child's handwriting, "Thank you, Uncle Vincent, for saving my dad." Vincent took the drawing with trembling hands. Stared at it. At this child's interpretation of the worst night of his life. Rendered in primary colors and innocent understanding. Vincent's voice broke. This is beautiful. Thank you. Emma tugged on her father's sleeve. Can Uncle Vincent come to our house? Like you said? James looked at Vincent, eyes asking permission. We'd like you to stay with us. While you recover. While you figure out what comes next. My father told me about his conversation with you. About the programs. The support. But in the meantime, you need a place. A family. And, his voice softened, we owe you everything. Vincent shook his head. You don't owe me anything. I did what any medic would do. No. James's voice was firm now. You did what very few medics could do. What even fewer would attempt. You held a position under fire for 43 minutes. Performed surgery without anesthesia. Kept me alive through sheer skill and will. Then you vanished. Refused recognition. Refused help. Suffered alone for years. His hand squeezed Vincent's shoulder. No more. You gave me my life. Let me give you a place to live it. The weight of the offer settled over Vincent. A place. A family. Children calling him uncle. A reason to wake up that wasn't just survival. I don't know if I can, Vincent whispered. Don't know if I'm strong enough. You held a compound against enemy combatants while saving a dying man. James smiled. I think you can handle breakfast with an 80-year-old and a 6-year-old. Despite everything, Vincent felt himself smile. It was small, rusty from disuse, but real. Okay, he said quietly. Okay, I'll try. The room erupted, not loudly, but warmly. Smiles, nods, approval from people who understood what that acceptance meant. Dr. Chen stepped forward. She had been crying quietly. I want to say something. To everyone here. She looked at Vincent. I've been a doctor for 6 years. Thought I knew how to practice medicine. Thought I understood what mattered. Then you showed me that sometimes the most important skill isn't reading labs or interpreting scans. It's seeing, really seeing, not just the patient, but the person. Her voice strengthened. You saved Jake's life with observation and experience. But you taught me something more important. You taught me not to judge, not to assume, to listen, even when it's difficult, even when the person speaking doesn't look like they have authority. Westbrook moved forward then. His expression was somber. Mr. Harlow, I need to say this publicly. In front of witnesses. I was wrong. About everything. I judged you by appearance. Dismissed your expertise. Threatened you. Almost cost a patient his life because of my arrogance. He looked at the gathered staff. I've requested a formal review of my actions. But more importantly, I've requested additional training. An implicit bias. In listening to non-traditional sources of medical information. In humility. Vincent studied him. Saw genuine contrition. Genuine desire to change. That's brave, doctor. Admitting mistakes isn't easy. It's necessary. Westbrook met his eyes. And overdue. Thank you for the lesson. Even though I made you pay dearly to teach it. Colonel Morrison stepped forward. Placed a wooden box on the small table beside Vincent's gurney. Opened it. Inside, resting on blue velvet, were dog tags. Vincent's dog tags. The ones he had lost years ago. Sold for food, or traded, or simply misplaced in the chaos of homelessness. James had these made, Morrison said. Exact replicas. Including, he lifted them carefully, your son's name engraved on the back. Ryan Michael Harlow. Because James said you carried your son with you always. And you should never have to stop. Vincent reached out, touched the cool metal, saw his name, his service number, and on the back, Ryan's name, his dates, his rank. The tears came then. No stopping them. 7 years of grief and loss and survival breaking through the walls he had built. Vincent wept, not quietly, not with dignity, but with the full weight of everything he had carried. James's hand was on his shoulder. Morrison's on his arm. Dr. Chun was crying too. Even Westbrook looked away, visibly moved. Emma's small voice cut through the emotion. Why is Uncle Vincent crying? Is he sad? James knelt beside his daughter. He's crying because he's been sad for a very long time. And now, maybe for the first time in years, he has a reason not to be. He's crying because he's coming home. Vincent looked at the gathering. At Jake, alive and recovering. At James and his children. At Morrison. At the medical staff who had learned from his presence. At the dog tags with his son's name. Still here, Ryan, he whispered. And finally coming back. Not running anymore. Not hiding. Just, he looked at James's children. Try to live in a way that honors you. David reached out tentatively. Touched Vincent's hand. We'll help you, Uncle Vincent. Mom says that's what families do. Vincent nodded. Unable to speak. Just holding the dog tags. Feeling their weight. Their promise. Their reminder that some things endure. That love survives loss. That healing is possible even after years of wounds. The hospital administrator arrived 20 minutes later. Margaret Pierce was a woman in her 50s with steel gray hair and the kind of presence that commanded rooms without effort. She moved through the crowded bay with purpose, her eyes taking in the gathering with sharp assessment. Mr. Harlow, she said, extending her hand. I'm Margaret Pierce, hospital administrator. I apologize for the delay in meeting you. I was in meetings when this situation developed. Vincent shook her hand. His grip was still weak from days of malnutrition, but her clasp was gentle, respectful. Pierce turned to address the room. Her voice carried authority. I've spent the morning reviewing the events that brought Mr. Harlow to our emergency department, reading incident reports, listening to staff accounts, and I need to say several things publicly. The room quieted. Even the children sensed the shift in atmosphere. First, to Mr. Harlow directly. Pierce faced Vincent. You saved a patient's life despite being systematically dismissed, mocked, and threatened by our staff. You demonstrated expertise that our physicians initially refused to acknowledge. You maintained dignity under circumstances that would have broken most people. And you did all of this while homeless, injured, and in significant pain. She paused. On behalf of County General Hospital, I apologize. What happened to you here should never happen to anyone. Vincent started to respond, but Pierce held up a hand. Second, to Dr. Westbrook. She looked at him. Your actions represent a failure not just of medical judgment, but of basic human decency. You will be suspended pending a full review. That review will determine whether you continue practicing at this facility. But regardless of the outcome, your behavior has cost this hospital credibility and nearly cost a patient his life. Westbrook nodded, accepting the consequences. I understand, ma'am. Third, Pierce continued, to our entire medical staff. This incident reveals systemic issues. How we treat homeless patients. How we respond to non-traditional sources of medical information. How we allow bias to cloud clinical judgment. Her voice strengthened. Effective immediately, all staff will undergo mandatory training in implicit bias, trauma-informed care, and cultural competency. We will establish protocols for verifying veteran status and accessing military medical expertise. And we will create a formal mechanism for patients and family members to escalate concerns when they feel unheard. Dr. Chin stepped forward. Ma'am, if I may, I'd like to propose that we invite Mr. Harlow to participate in that training, to share his perspective, to help us understand what we missed and why. Pierce looked at Vincent. Would you be willing to do that, Mr. Harlow, once you've recovered? Vincent glanced at James Morrison, who nodded encouragingly. Then at Jake Chun, who was smiling. I'll do whatever helps prevent this from happening to someone else, Vincent said quietly. Good. Pierce made a note on her tablet. Fourth, We need to address the viral nature of this story. As of this morning, the article about your case has been shared over 100,000 times. Local news outlets are requesting interviews. Veterans organizations are calling. The attention is, she chose her words carefully, significant. James Morrison spoke up. With your permission, Senior Chief, I'd like to handle media inquiries. My father has connections. We can control the narrative. Make sure your story is told with respect. Vincent nodded, grateful for the protection. I don't want attention. Just want to make sure something good comes from it. Something good is already coming from it, Pierce said. She pulled out her tablet, scrolled through something. We've received over 200 emails from veterans sharing similar experiences. Being dismissed in emergency rooms, having their service questioned, being treated as less than because of appearance or circumstances. Your story has opened a conversation this hospital and this city desperately needed. A voice from the doorway interrupted. May I add something? Everyone turned. A woman in her 40s stood there. Professional attire. Camera crew behind her. Press credentials around her neck. I'm Amanda Torres, she said. Investigative reporter with Channel 7 News. I've been covering veteran homelessness for 3 years. She looked at Vincent. Your story, Mr. Harlow, represents everything broken about how we treat our service members after they come home. But it also represents hope. Because you survived. Because you kept your skills. Because when the moment came, you were still the hero you always were. Vincent shook his head. I'm not a hero. Just did what I was trained to do. Torres smiled sadly. That's what every hero says. She addressed Pierce. I like to do a feature story. Not just about this incident, but about the larger issue. Veteran homelessness. PTSD. The gaps in our support systems. The way we judge people by appearance rather than character. She looked back at Vincent. With your permission, I'd like to tell your complete story. Not to exploit it, but to change minds. To save lives. Vincent was quiet for a long moment. Looked at the dog tags in his hands. At Ryan's name engraved on the back. At James Morrison and his children. At Jake Chun, alive because someone had listened. If it helps other veterans, he said finally. If it makes people think twice before dismissing someone, then yes. Tell the story. Torres nodded. Thank you. We'll do this right. I promise. Colonel Morrison moved to Vincent's bedside. Senior Chief, there's something else you should know. The Vincent Harlow Memorial Fund that James has been running, it's received over $30,000 in new donations since yesterday. People who read your story. People who want to help veterans like you. Vincent's eyes widened. $50,000? Just in the last 24 hours, Morrison confirmed. And it's still growing. People are responding to your story. To your sacrifice. To the reminder that heroes live among us, often invisible and struggling. Jake Chin spoke up. His voice was stronger now, growing more confident. Sir, I want to start a foundation. For combat veterans in crisis. A hotline they can call when they feel invisible. When they're being dismissed. When they need someone to listen. He looked at Vincent with fierce determination. I want to call it Sentinel. After your call sign. Because that's what you were for me. Someone watching. Someone who saw me when no one else did. Vincent's breath caught. Sentinel. The call sign he had earned decades ago. The identity he had carried through wars and losses and years on the streets. That would honor me, son, more than you know. James Morrison's daughter Emma tugged on Vincent's hand. She had been quiet, listening to the adult conversation with the patient confusion of childhood. Uncle Vincent, she said, when you come stay with us, can you teach me to be brave like you? Vincent looked down at her, at this small person with her father's eyes. Her innocent belief that bravery was something that could be taught rather than something forced upon you by circumstance. I could teach you something better, sweetheart. I could teach you to be kind. Because kindness is harder than bravery. Kindness means seeing people who others ignore. Helping people who can't help you back. Staying gentle even when the world is hard. Emma considered this seriously. Okay, I want to learn that. David, the 80-year-old, had questions of a different nature. Uncle Vincent, did you really do surgery while people were shooting at you? Vincent smiled slightly. Yes, I did. Were you scared? Terrified. Every second. But being scared doesn't mean you stop. It means you keep going even though you're afraid. That's what courage really is. The boy absorbed this, looked at his father, then back at Vincent. Dad says you're the bravest person he ever met. Your dad is braver than me, Vincent said quietly. He survived. He healed. He built a life. That takes more courage than anything I ever did in combat. James Morrison's eyes glistened. He put his hand on Vincent's shoulder. We're going to get you out of here soon. Get you home. Get you healthy. And then, when you're ready, we're going to figure out what comes next. Together. Dr. Chun approached with a small bag. Inside were Vincent's few possessions. The clothes he had been wearing. The photograph of Ryan that he carried always. A worn book. The small things that comprised his entire material world. We cleaned your photograph, she said gently. It was damaged. We had it restored. She pulled it out carefully. The photo looked different. Clearer. The creases smoothed. Ryan's face bright and young and alive. Vincent took it with trembling hands. Thank you, he whispered. The room had fallen quiet. This moment too sacred for interruption. A father holding a photograph of his dead son. Surrounded by people who saw him. Really saw him. Not as a homeless man or a problem or a statistic. But as a human being who had suffered and survived and still had something to offer the world. Margaret Pierce broke the silence gently. Mr. Harlow, you're being discharged this afternoon. Medical clearance, pending final labs. But you're free to leave whenever you're ready. Vincent looked around the bay. At the faces gathered there. At Jake, who would live. At James and his children, offering family. At Morrison, offering support. At Chun and the medical staff, offering respect. At Torres, offering voice. At Pierce, offering accountability. 7 years on the streets. 7 years of believing he deserved nothing. 7 years of running from help and hope and healing. And in one morning, surrounded by strangers who had become something like family, Vincent Harlow finally understood what James Morrison had tried to tell him. Surviving wasn't betraying the dead. Living wasn't dishonoring their memory. Accepting help wasn't weakness. It was the hardest battle of all. And maybe, finally, he was ready to fight it. Still here, Ryan, he thought, looking at the photograph. Still here. And maybe that's not something to apologize for anymore. Maybe that's something to build on. The dog tags hung around his neck now. Cool metal against his chest. His name. His service. And on the back, forever, his son's name. A reminder that love endures. That sacrifice matters. That one person, seeing clearly in the darkness, can change everything. Vincent Harlow had saved hundreds of lives over 23 years of service. Had pioneered protocols and trained generations and earned decorations most people would never see. But saving Jake Chun, refusing to be silenced, maintaining dignity when everyone dismissed him, that might have been his greatest operation of all. Because it reminded the world that heroes aren't always in uniform. That expertise doesn't expire. That the measure of a person has nothing to do with their address and everything to do with their character. And sometimes, just sometimes, the person who looks most broken is actually the strongest one in the room. The discharge process took 3 hours. Not because of medical complications, but because word had spread through the hospital like wildfire. Nurses wanted to meet him. Other doctors wanted to apologize. Patients who had served wanted to shake his hand. Vincent sat in a wheelchair, still weak but stronger than he had been in months, and received them all with quiet grace. Each handshake, each thank you, each story of dismissal or struggle or survival. An elderly Korean War veteran, in for pneumonia, gripped Vincent's hand with surprising strength. They call me crazy too, son. Said my nightmares weren't real. Said I was drug-seeking when I couldn't sleep. The old man's eyes were wet. Thank you for showing them we're not broken. Just carrying weight they can't see. A young female veteran, maybe 30, with a prosthetic leg, told him about being dismissed at 3 different emergency rooms before someone finally diagnosed her infection. Your story is already changing things, she said. People are listening now, paying attention. You did that. Vincent wanted to say he had done nothing, that he was just a homeless man who happened to know medicine. But he was learning to accept that his story mattered, that visibility, even painful visibility, could create change. James Morrison had stepped out to make phone calls, arranging transportation, preparing his home, calling his wife to explain that they were gaining a new family member. When he returned, his smile was bright. "Sarah, my wife, is thrilled. She's already set up the guest room. Told the kids they need to give you space to rest. Made it very clear that you're not a project, but a person." James sat down beside the wheelchair. "She's a social worker. Specializes in veteran reintegration. So fair warning, she's going to want to help. But she's good at respecting boundaries." Vincent nodded, grateful but still uncertain how this would work. Living with a family again after 7 years alone. Being around children. Having routines and expectations and people who cared whether he ate breakfast. "What if I can't do it?" Vincent asked quietly. "What if I wake up and need to leave? What if I can't handle being inside walls again?" James didn't dismiss the concern. Didn't offer empty reassurance. "Then you leave. Walk around the block. Sit in the backyard. Whatever you need. This isn't a cage. Document. It's a home. And homes have doors that open both ways. You're free to come and go. We just want you to have somewhere to come back to." The fear eased slightly. Not gone, but manageable. "Okay." Colonel Morrison returned with shopping bags. Inside were clothes. Simple things. Jeans, t-shirts, a warm jacket, socks, underwear, basic toiletries, all in Vincent's size. "Guessed on some of it," Morrison said, "but figure you needed something besides hospital gowns, or—" He gestured at Vincent's old clothes, those. Vincent looked at the worn flannel shirt he had been wearing, the boots held together with duct tape, the clothes that had marked him as homeless, as less than, as someone to dismiss. "Thank you, Colonel. This is generous. It's necessary, and it's the least we can do." Dr. Chun appeared with final discharge papers. She had been crying again, seemed to cry every time she looked at Vincent, as if his survival represented something larger than one homeless man accepting help. "Your labs look good," she said, reviewing the papers. "The antibiotics knocked out the infection. Fluids brought your levels back to normal. Your ribs will take 4 to 6 weeks to fully heal, but there's no complication there." She looked up. "Physically, you're on the mend. The rest," she smiled gently, "takes longer, but you have people now. Support. That matters more than medicine sometimes." Vincent signed the discharge papers. His hand still trembled slightly, but the signature was clear. Vincent Alexander Harlow. The name he had carried for 68 years. Through wars and losses and years of invisibility. Jake Chun arrived in a wheelchair of his own, pushed by a nurse. His surgery had been successful, but he would need days of recovery before discharge. He looked better, though. Color in his face. Strength in his voice. "Wanted to say goodbye," Jake said. "Or not goodbye. See you soon. Because I meant what I said about the Sentinel Foundation. I'm going to need your help building it. Your expertise. Your voice." Vincent studied the young man. Saw determination. Saw purpose born from near death. Saw someone who would turn trauma into something meaningful. "I'll help however I can, son." Jake pulled out a business card. Handed it to Vincent. "That's my direct number. Call anytime. Day or night. If you need something. If you're struggling. If you just want to talk to someone who understands what it's like to be seen when you thought you were invisible." His voice dropped. "You saved my life, sir. Not just from the bleed. From a feeling that nobody gave a damn. That I was just another number. Another problem. You cared. That matters." Vincent pocketed the card. "Thank you, Jake. And thank you for deciding to help others. Ryan would have liked that. Would have liked you. Tell me about him sometime?" Jake asked. "About your son?" Vincent nodded, unable to speak around the sudden tightness in his throat. After Jake left, Amanda Torres arrived with her camera crew. She had promised to respect Vincent's privacy, to handle the story with care, and her approach proved it. The camera stayed back. The lights were soft. The questions were gentle. "Mr. Harlow, I want to start with a simple question. Why did you refuse pain medication?" Vincent looked directly at the camera. "Because I needed to stay alert. To watch. To see what others were missing. In combat medicine, we learn that pain is just information. It tells you what's damaged. It doesn't always require medication. And in this case, staying sharp mattered more than comfort because a young man's life depended on someone paying attention. And when the medical staff dismissed you, when they threatened psychiatric holds? Why didn't you just give up? Vincent was quiet for a moment, choosing his words carefully. Because I've seen too many young warriors die. Because I lost my own son and couldn't save him. Because when you've carried that kind of grief, you'll do anything to prevent someone else from carrying it. Even if it means being mocked, threatened, dismissed. You fight for the ones who can't fight for themselves. Torres nodded slowly. Your story has resonated with millions of people. Why do you think that is? Vincent met her eyes. Because everyone has felt invisible at some point. Everyone has been dismissed or underestimated or judged by appearance. My story isn't special. It's common. Too common. The only difference is that mine had cameras and articles. But for every veteran who gets attention, there are hundreds who suffer quietly, who die quietly, who never get their moment of vindication. His voice strengthened. If my story changes how we see homeless people, how we treat veterans, how we listen to voices that don't fit our expectations, then maybe Ryan's death wasn't meaningless. Maybe all this pain can become something good. The interview continued for 20 minutes. Torres asked about his service, about Kandahar and Morrison, about the years on the streets, about what came next. Vincent answered honestly, without embellishment, without making himself larger or smaller than he was. When it ended, Torres thanked him, promised the story would air in 3 days, promised she would send him the final cut before broadcast, promised his voice would be heard clearly. Finally, as afternoon shadows lengthened across the hospital floor, James Morrison brought a car around. Colonel Morrison helped Vincent into clean clothes. The jeans fit well. The jacket was warm. The new boots felt strange after years of duct-taped relics. Vincent caught his reflection in the bathroom mirror. Hardly recognized himself. Clean, dressed, looking less like a homeless man and more like someone's grandfather. Someone's uncle. Someone who mattered. The dog tags hung around his neck, visible now against the new shirt. His name on one side, Ryan's on the other. Dual identities, dual purposes. Father and medic, grieving and healing, lost and found. Ready? James asked from the doorway. Vincent touched the dog tags once, felt their weight, their promise. Still here, son. Still trying. And this time, not alone. He turned from the mirror, nodded. Ready? The wheelchair ride through the hospital felt different now. Not shame or invisibility, but something closer to respect. Staff members stopped what they were doing. Watch him pass. Some nodded. Some saluted. One elderly nurse made the sign of the cross, lips moving in silent prayer. At the entrance, the Morrison family waited. James's wife Sarah was there, kind-faced and warm-eyed. David and Emma bounced with barely contained excitement. Colonel Morrison stood with military bearing but gentle expression. And beyond them, in the parking lot, Vincent saw something that made him stop. News vans. At least a dozen. Cameras pointed toward the entrance. Reporters waiting. James saw his hesitation. You don't have to say anything. We can go out the back. Avoid all of this. Vincent shook his head slowly. No. If this helps others, if this changes minds, then it's worth it. He looked at James. But stay close. Always document. Always. They moved through the automatic doors together. Into sunlight. Into attention. Into a world that suddenly saw Vincent Harlow not as a homeless problem, but as a decorated veteran. A hero. A human being who mattered. The cameras flashed. The questions came rapid fire. Vincent raised a hand. The crowd quieted. I'm not a hero, Vincent said. His voice carried across the parking lot. I'm just a medic who did his job. But I want to say this to every veteran watching. Every person who feels invisible. Every soul who thinks they don't matter. You do. Your service matters. Your struggle matters. Your life matters. And if my story teaches anything, let it teach this. Never judge a person by their circumstances. Look deeper. See clearer. Because heroes walk among us every day. Often unrecognized. Often struggling. Often waiting for just one person to see them. He paused. Looked at the cameras. Thought about all the people watching. All the veterans who needed to hear this. And to the medical professionals, the first responders, anyone who works with people in crisis. Listen. Really listen. especially to the voices that don't fit your expectations. Because sometimes the homeless man is a decorated veteran. Sometimes the person who looks broken has saved more lives than you can imagine. Sometimes the smallest act of listening, of seeing, of caring, saves a life. The questions erupted again, but James was already moving Vincent toward the car, protecting him while honoring his choice to speak. As they drove away from County General Hospital, Vincent watched through the window, saw the building where he had almost died, where he had saved Jake, where he had been dismissed and vindicated, where everything had changed. Sarah Morrison, from the driver's seat, caught his eye in the rearview mirror. "Welcome home, Vincent. We're glad you're here." Home. The word felt foreign, frightening, hopeful. Vincent touched the dog tags, felt Ryan's name under his fingers. "Still here, son." And finally ready to try again. The Morrison house was a two-story colonial in a quiet suburb. Trees lined the street. Children's bikes lay in driveways. It was the kind of neighborhood Vincent had lived in once, the kind he thought he would never see again. Sarah Morrison pulled into the driveway and turned off the engine, sat for a moment before speaking. "Vincent, before we go inside, I want to set some ground rules. Not restrictions, just clarity." Vincent nodded, listening. "First, this is your home for as long as you want it. No timeline. No pressure. You're not a guest. You're family. Second, we respect your need for space. If you need to be alone, say so. If you need to leave for a walk, leave. The door is always open. Third," she turned to look at him directly, "we know healing isn't linear. Bad days will happen. Nightmares. Triggers. Whatever comes. We're ready for it. You don't have to hide your pain here." Vincent's throat tightened. "Thank you. That means more than you know." The children had been quiet during the drive, but now Emma spoke up. "Uncle Vincent, do you like dogs? We have a dog named Riley. He's very friendly." "I like dogs," Vincent said softly. "Haven't been around one in years, though." "Riley will love you," David declared with childhood certainty. "He loves everyone." Inside, the house smelled like home cooking. Warm bread, something with garlic and herbs. Vincent's stomach growled audibly. He couldn't remember the last real meal he had eaten. The guest room was on the first floor. Small but comfortable. A bed with clean sheets. A dresser. A window overlooking the backyard. Simple, but more than Vincent had known in 7 years. Sarah showed him the attached bathroom. Fresh towels. New toiletries. Everything you might need. "Take your time," she said. "Shower. Rest. Come out when you're ready. Dinner's in an hour, but there's no rush." After she left, Vincent stood in the middle of the room, uncertain what to do with privacy, with comfort, with the absence of vigilance required for street survival. He moved to the window, looked out at the backyard, saw a swing set, a garden, a dog lying in the sun. Normal life, the kind that had seemed impossible for so long. The shower was the first real one in months. Hot water, soap that lathered, shampoo. Vincent stood under the spray and let it wash away layers of grime and street living and desperate survival. Watched the water circle the drain, brown at first, then gradually clearing. When he finally emerged, wrapped in a clean towel, he caught his reflection again. Gaunt still, scars visible, but clean, human, recognizable as something other than invisible. He dressed in the new clothes, found that Colonel Morrison had included a razor and shaving cream. Vincent hesitated, then shaved carefully, watching his face emerge from beneath the beard, seeing himself for the first time in years. The man in the mirror was old, weathered, marked by loss and time, but alive, still alive. When Vincent emerged from the room, the smell of food was stronger. He followed it to the kitchen, where Sarah was cooking and the children were setting the table. James was helping, and the scene was so achingly normal that Vincent had to pause in the doorway. James saw him first, smiled. "Doc, you clean up pretty well." Sarah turned from the stove. Her expression softened. "You look good, Vincent." "Rested." The children stared at him with open curiosity. Emma whispered to her brother, "He looks different, like a grandpa now, instead of," she struggled for words, "someone who lives outside." David elbowed her. "Mom said we're not supposed to talk about that." Sarah intervened gently. It's okay to notice changes, sweetie. Uncle Vincent does look different when he's clean and rested. That's what happens when people get the care they need. Dinner was pot roast with vegetables, homemade bread, food that tasted like love and normalcy and everything Vincent had given up when he walked away from his life. He ate slowly, savoring each bite, trying not to eat too quickly despite the hunger that gnawed at him. The conversation flowed around him. David talked about school. Emma described her art project. James mentioned work. Sarah asked about everyone's day. Normal family dinner conversation that felt surreal after years of eating alone in alleys or shelters. Uncle Vincent, Emma asked suddenly, "Did you know my daddy when he was in the war?" Vincent set down his fork carefully. "I knew your daddy during a very scary time. He was hurt, and I helped him get better. Were you scared?" Emma's eyes were wide. "Very scared. But I did my job anyway because that's what medics do. We take care of people even when we're afraid." David had been quiet, but now he spoke up. "Dad says you saved his life. That he wouldn't be here if it wasn't for you. That we wouldn't be here." Vincent looked at James, who nodded. "It's true." David continued, voice serious beyond his years. "So that means you're like the most important person in our family. Because without you, there wouldn't be a family." The weight of that statement settled over the table. Sarah reached over and squeezed Vincent's hand. "He's right. You gave us everything. And we don't take that lightly." Vincent had to look away, focus on his plate. On the food, he could barely taste now through the emotion. "I just did what any medic would do." James shook his head. "No, look. You did what very few people could do. And you've been punishing yourself for 7 years because you couldn't save everyone. Couldn't save Ryan." His voice was gentle but firm. "But you saved me. You saved Jake. You've saved hundreds over your career. At some point, you have to let that count for something." Vincent was quiet for a long moment. Then, so softly they almost couldn't hear, "I'm trying. Still learning how." "That's enough," Sarah said. "Trying is enough." After dinner, the children wanted to show Vincent their rooms. David's was covered in posters of fighter jets and astronauts. Emma's was pink and purple with drawings covering every wall. Both rooms spoke of childhoods lived in safety, in love, in possibility. "This is you and Daddy," Emma said, pointing to one of her drawings. It showed 2 stick figures, one lying down, one standing over with hands reaching, bullets drawn as lines. Above it, in careful letters, "Uncle Vincent the hero." Vincent knelt down to her level. "Can I tell you a secret, sweetheart?" Emma nodded eagerly. "Heroes aren't people who aren't scared. Heroes are people who are terrified but do the right thing anyway. And the biggest heroes aren't always the ones who save lives. Sometimes they're the ones who are kind when it's easier to be cruel, who see people others ignore, who choose love even when they're hurting." Emma considered this. "Like Mom? She always helps people nobody else wants to help. Exactly like your mom." Vincent smiled. "Your mom is one of my heroes." Later, after the children were in bed, Vincent sat with James and Sarah in the living room. Riley, the golden retriever, had claimed Vincent's feet as a spot. The dog's warmth was comforting, grounding. "How are you really doing?" Sarah asked. She had the directness of someone who worked with trauma daily. Vincent thought about lying, about saying he was fine, but these people deserved honesty. Terrified, grateful, confused. Like I'm waiting for someone to realize this is a mistake and take it all away. "It's not a mistake," James said firmly. "And nobody's taking anything away. You belong here." Sarah leaned forward. "Vincent, I work with veterans every day. Combat trauma, PTSD, homelessness. I know the statistics. I know how hard recovery is. And I want you to know we're in this for the long haul. Bad days, setbacks, whatever comes. You're not doing this alone anymore." Vincent nodded, unable to speak. "Tomorrow," Sarah continued, "I'd like to take you to the VA. Not the bureaucratic nightmare you dealt with before. There's a new program, run by veterans for veterans. No paperwork masses. No lost files. Just people who understand. People who can help with benefits, housing eventually if you want it, medical care, counseling. Whatever you need. What if I'm not ready? Then we wait until you are." "But Vincent," she met his eyes, "you don't have to earn the right to help. You don't have to prove you're worthy. You already are." just by being human, just by surviving. The dog shifted at Vincent's feet, made a contented sound. Vincent reached down to pet him. The simple act of touching something living and warm felt profound after so long alone. James pulled out his phone. "Doc, I want to show you something." He scrolled to a video. Hit play. It was Jake Chun, standing outside County General Hospital, speaking to a camera. Behind him, a banner read Sentinel Foundation, because everyone deserves to be seen. Jake's voice was strong, clear. 2 days ago, I almost died because nobody was listening. Nobody except a homeless veteran who refused to be silenced. Vincent Harlow saved my life, not just with his medical expertise, but with his refusal to accept that some voices don't matter. He saw me when I was invisible. And now, through the Sentinel Foundation, we're going to see others. We're going to listen. We're going to make sure no veteran feels dismissed or forgotten ever again. The video showed Jake standing with other veterans, young and old, different branches, different eras, all holding signs. I am seen. I matter. My service counts. We're launching next week, Jake continued. A 24-hour hotline, peer counselors, emergency response teams, housing assistance, medical advocacy. Everything that Vincent did for me, we're going to do for thousands. Because that's what he taught us. That seeing someone, really seeing them, can save their life. The video ended. James looked at Vincent. That's your legacy. Document. Not just the lives you saved in combat, but the movement you started by refusing to stay invisible. Vincent stared at the frozen image on the phone, at Jake's face, at the veterans behind him, at the promise of help for others who felt unseen. Still here, Ryan, he thought, and maybe, finally, doing something that matters, something that honors you. Sarah stood. It's late. You should rest. Tomorrow is a new day, new possibilities. Vincent nodded, stood carefully. Riley followed him to the guest room, curled up on a rug beside the bed, standing guard the way Vincent had stood guard for so many others. In the quiet darkness, Vincent lay in a real bed with clean sheets and a roof overhead. The dog tags rested against his chest, his son's name warm against his skin. For the first time in 7 years, Vincent Harlow allowed himself to believe that survival might be enough, that healing was possible, that invisible men could be seen again, that coming home, even after being lost for so long, was not just a dream, but a reality unfolding one day at a time. Still here, son, still trying. And tomorrow, maybe try a little harder, maybe believing a little more, maybe becoming someone you'd be proud of again. 3 months later, Vincent Harlow stood at Arlington Heights Military Cemetery. The morning air was cool. Autumn leaves scattered across the grass. But this time, he wasn't alone. Emma held his left hand. David held his right. Behind them, James and Sarah Morrison stood quietly. Riley sat at attention. The service dog Sarah had gotten him gleaming in the sunlight. "Good morning, Ryan," Vincent said quietly. His voice was stronger now, steadier. 3 months of regular meals and safety and sleep had rebuilt what 7 years had torn down. "Brought some people to meet you, son." Emma stepped forward with a drawing. She placed it carefully at the base of Ryan's headstone. It showed stick figures. A lot of them. Uncle Vincent and all the people he helps now, she explained to the granite marker. "He's teaching us to be kind." David added a small American flag to the other side. "For your service, sir. Dad says you were a hero too, like Uncle Vincent." Vincent's throat tightened. He knelt slowly, ribs fully healed now, and touched his son's name. Ryan Michael Harlow. Forever 24. Forever Marine. Forever missed. "I'm doing better, son." Vincent's voice was low, private. The family gave him space. Living with the Morrisons. Working with the Sentinel Foundation. Teaching combat medicine again at the VA hospital. Helping other veterans who feel invisible. His fingers traced the engraved letters. Jake's foundation has helped over 200 veterans in 3 months. Got them housing, medical care, someone who listens. We're doing good work. Work that honors you. A breeze rustled the leaves. Vincent imagined it was Ryan's response. Approval from beyond. Permission to keep living. The interview with Amanda Torres had aired 6 weeks ago. The response had been overwhelming. Donations flooded the Sentinel Foundation. Veterans reached out by the hundreds, sharing stories, asking for help, thanking Vincent for making them visible again. The hospital where Vincent had been dismissed had made sweeping changes. Mandatory training, new protocols. Dr. Westbrook had completed his suspension and returned with humility Vincent respected. The young doctor had even volunteered at the Sentinel Foundation, trying to make amends by listening better. Vincent stood. The family rejoined him. James's hand rested on his shoulder. "Ready?" James asked. Vincent nodded. "One more stop first." They drove 15 minutes to another cemetery. Smaller, quieter. Sarah Catherine Harlow, beloved wife and mother. The headstone was simple, like Ryan's, like Sarah would have wanted. Vincent knelt again. "Hello, love. Been a while since I could visit proper." He paused, been living instead of just surviving. "Think you'd like the Morrisons. James is the boy I saved in Kandahar. Remember I told you about that night? His kids call me uncle. His dog follows me everywhere. It's good. Strange but good." He pulled out a photograph, set against Sarah's stone. It showed Vincent with the Morrison family, all of them smiling. Riley in the center. It had been taken 2 weeks ago at David's soccer game. A moment of normal family life that Vincent was learning to accept. "I'm teaching again, Sarah, at the VA hospital. Combat medicine, trauma protocols, the things I pioneered, the things I thought I'd never use again." Vincent's voice cracked. "And I'm helping veterans who feel like I felt. Lost, invisible, broken. Jake's foundation is saving lives. Real lives. Because one person saw me when everyone else looked away." The wind picked up. Vincent imagined it was Sarah's hand in his hair, the way she used to touch him when words weren't enough. "I'm not over losing you. Or Ryan. Don't think I ever will be. But I'm learning to carry it differently. Not as punishment. As," he searched for the word, "as purpose. Every veteran I help. Every life we save through the foundation. It's for you both. Because you taught me that love doesn't end. It transforms. Becomes something that helps others." Emma approached quietly. Placed flowers at Sarah's grave. Purple ones. Sarah's favorite according to the stories Vincent had shared. "For Aunt Sarah. So she knows we're taking good care of Uncle Vincent." Vincent gathered the little girl into his arms. Held her close. "Thank you, sweetheart. That's very kind." After the cemetery, they drove to the VA hospital. Vincent now taught there 3 days a week. The same protocols he had developed decades ago. Updated with his street experience, with his understanding of trauma, with everything he had learned in 7 years of survival. The classroom was full when he arrived. 20 medical students, 10 VA doctors, 5 combat medics on active duty, all there to learn from a man who had performed surgery in a firefight, who had saved lives in impossible conditions, who had remained a medic even when he had nothing else. Today's lesson, Vincent began, is about seeing. Really seeing, not just the injury but the person, not just the symptoms but the story. He moved to the board, wrote coordinates, 34.5253 degrees north, 69.1725 degrees east. Kandahar Province, August 14, 2009. I operated on a critically wounded officer in a collapsed building while under direct enemy fire. No anesiche, no imaging, no laps. Just observation, experience, and the absolute certainty that this man's life mattered more than my fear. The room was silent, attentive. These students would never dismiss a homeless veteran, would never assume appearance determined expertise. Vincent's story had changed that. Permanently. After class, Jake Shun was waiting in the hallway. He walked with only a slight limp now, the surgery scar hidden beneath his shirt, but the experience visible in his eyes. In his purpose. "Doc, got the numbers for this month." Jake showed him a tablet. 217 veterans helped. 36 housed. 42 connected to medical care. 15 suicide intervention. All because someone answered the phone. Listened. Saw them. Vincent studied the numbers. Each one a life. A person who mattered. "That's good work, Jake. Really good work." Jake smiled. "It's your work, sir. We're just following your example." He paused. "There's something else. We got a call this morning. From a Department of Defense. They want to make your trauma protocols official military doctrine. Name them the Harlow Protocols. Your legacy enshrined in every combat medic's training. Vincent sat down heavily. His protocols, his life's work, recognized, remembered, not forgotten in 7 years of homelessness, but preserved, honored. Ryan would have been proud, Vincent said softly. He is proud, Jay corrected gently. Wherever he is, he's proud. Because you kept fighting, kept helping, kept being the man who runs into the fire to save others. That evening, back at the Morrison house, there was a surprise. The doorbell rang, and Sarah answered it. Returned with Colonel Morrison and an entire delegation. Veterans, hospital administrators, city officials, news crews. What's happening? Vincent asked, confused. Sarah smiled. You'll see. The mayor stepped forward. Mr. Harlow, on behalf of the city, I'd like to present you with the key to the city. For your service, your sacrifice, and your continued dedication to helping others even when you had nothing yourself. The ceremony was brief. Photographs taken, speeches made. But what Vincent would remember was what came after. One by one, veterans approached. Men and women Vincent had never met. Each one telling their story. I called the Sentinel hotline 3 weeks ago. I was planning to end my life. The person who answered listened, really listened, got me help. I'm alive because of you. I was dismissed at an emergency room 6 months ago. Your story made me fight back. Demand proper care. They found the cancer. Early stage. Treatable. I'm here because you showed us our voices matter. I am homeless. Have been for 2 years. Saw your interview. Reached out to the foundation. They got me housing. Job training. Hope. You gave me hope. Story after story. Life after life. Vincent stood in the Morrison living room surrounded by people who existed because he had refused to stay invisible. Because he had kept his skills sharp. Because he had seen Jake Shun when everyone else looked away. Amanda Torres was there with her crew, capturing the moment. She approached Vincent with a smile. This is the follow-up story, she said. 3 months later, the impact of one man refusing to be silenced. She gestured at the gathered crowd. This is what change looks like, Mr. Harlow. Real, measurable, beautiful change. After everyone left, after the children were in bed, Vincent sat on the back porch with James. Riley at his feet, stars visible above. The night quiet and peaceful. How does it feel? James asked. All of this. The recognition, the foundation, the lives saved. Vincent was quiet for a long time. Then, overwhelming. Humbling. Like maybe, finally, the pain had purpose. Like Ryan and Sarah didn't die for nothing. Like their love became something that helps others. James nodded. That's exactly what it is. Love transforming into service. Pain becoming purpose. One man's refusal to quit changing hundreds of lives. Vincent touched the dog tags around his neck. His name. Ryan's name. 2 lives intertwined forever. Still here, son. Still helping your brothers and sisters. Still making sure nobody feels invisible. Still trying to be someone you'd be proud of. The stars wheeled overhead. Constant. Eternal. Witnesses to human suffering and human triumph both. Vincent Harlow had saved hundreds of lives in combat. Had pioneered medical protocols. Had earned decorations most people would never see. Had survived wars and losses and 7 years on the streets. But saving Jake Shun might have been his greatest operation, because it reminded the world that expertise doesn't expire, that heroes aren't always in uniform, that the person who looks most broken might be the strongest one in the room. And sometimes, the greatest act of courage isn't charging into enemy fire. It's accepting help. It's allowing yourself to be seen. It's choosing to keep living even when survival feels like betrayal. Vincent stood, stretched, felt his body respond without the constant pain of malnutrition and exposure. Felt strength returning, purpose growing, life becoming something more than just breathing. Inside, Sarah had left a light on for him, the way families do, the way homes feel, safe, warm, full of people who care whether you come back. Vincent walked inside, Riley following close, the dog tags cool against his chest. His son's name a constant reminder that love endures, that sacrifice matters, that one person seeing clearly in the darkness, can change everything. Still here, Ryan. Still trying. Still helping. And finally understanding that being here is enough. That surviving was never betraying you. That living with purpose honors you more than dying with guilt ever could. The door closed softly behind him. The lock clicked. And Vincent Harlow, decorated combat medic, homeless veteran, and now teacher, advocate, and living reminder that everyone deserves to be seen, went to sleep in a home filled with love, where nightmares came less frequently, where healing happened slowly, where invisible men became visible again through the simple act of refusing to give up, where one man's story changed thousands of lives, and where, every morning, he still whispered to his son, still here, still trying, still loving you, and that finally was enough.